Baumgartner here, representing MedFit and Apex. So super excited about this upcoming mini workshop because we're going to today and learn how to do a bone marrow harvest and how to really do something that's really an incredible gift to your patients. I've been doing regenerative things for probably about 15 years. You know, back in the day, it started with prolotherapy, and then the technology came out a few years later to do PRP. And then really quickly after that, the stem cell technology came around where we were able to do bone marrow harvest and actually create a solution that is very effective at helping the body heal. So if you're already involved in doing the prolotherapy, which I really think is the bread and butter where we all need to start, and then you're upgrading to the biologics, adding the bone marrow harvest as one of your skill sets is probably very important because it's going to enable you to really crank up that ability to heal. This is kind of an overview talk. It's not going to be all the heavy details, but I want to give you the overview so you can get excited about being able to do these procedures for your patients. Now, unfortunately, with everything good, there's the weight of that, right? There's the balance. We need to know the complications. There is going to be a risk of hemorrhage. You have your gluteal arteries, you have some veins back there as well. And if they're on blood thinners, they're going to bleed more. But you have to be aware that there are some arteries in that area as well. The technique I'm going to teach you does help you avoid that complication. Now we have to know our anatomy very well. The better you know your anatomy, you kind of know what's under the skin. And that's what we're going to see when we put the ultrasound probe there is the anatomy. But you have to have that 3D anatomy in your head. So we're looking at the PSAS back here, and you want to mark the skin. Every patient I see, I mark the skin first. You want to mark the iliac crest. This is going to be the level of L4, the interspace. As you come around here, palpating, big bony structure down there. That's the PSIS. And then we'll do that symmetrically on both sides. So we're going to just confirm exactly the location there. You want to be very accurate, not only on the medial aspect of the PSS, but especially the lateral aspect of the PSS. When we do a lot of lumbar procedures, we're more concerned about this landmark, the medial, but with the bone marrow harvest, we want to make sure this landmark here is real accurate because we're going to be coming in from a lateral to medial approach. So again, lidocaine is important. So what I'm doing is this little skin bleb, making sure that skin's really anesthetized, and then you're doing little tracks to follow down through the muscle. And then the rest of it is going to be done with ultrasound guidance. We're going to use the ropivacaine down to the periosteum. And I'll show you a little secret there on how to numb up that periosteum. Again, because you want their friends coming back, and this is the most important part. We have the pulled back point of view, and what I think is exciting about this technology and the teaching that we're doing is that we can use a third ultrasound as well. So we're having a mastermind coming up in February, which will be using the same kind of trifecta technology to teach virtually or in person in February, where you can see the point of view, but you can also see what the point of view is showing on the ultrasound, which is so important when it comes to learning, is to see what you're seeing on that ultrasound. So it's really sometimes almost better than being up here with me, is to see it that way. So when you put the ultrasound right down, got a little bit extra lidocaine, so I'm going to go back and pepper the number 2 spot and the number 1 spot again too. You can see the needle there right underneath that little knob where the fascia is between the 2 glutes. So again, pop the skin first. Then get the ultrasound up. Watch where it's going. You want to go right underneath that little knob there, about 2 centimeters down from the top of the crest, so you can see the little ridge separating the glutes. And I'm going to anchor a little bit. And once you've anchored, then the probe won't, or the trocar won't slip. And then we're going to just wig-wag and go ice fishing. Here we go. Good job. 3, 2, 1. Breathe out. You're doing great. Site number 2, you only have 4 left. You're doing awesome.
Really a challenge for you to see this, but this is the plasma, and then the buffy coat is 2 centimeters down into the red blood cells. Now, if you were here, you could see there's a dark rim representing that buffy coat. It's very easy to see as we are here, but it's difficult for you guys. But it's the syringe. Place the procedural syringe on. And then we're just going to take 6 cc's of product. There's the buffy coat coming in. And there we go. 2 cc's, 6 cc's of product. I'm going to go a little bit more right there. Perfect. Let me pull that out. We have these sterile caps that go on to the procedural syringe. And there is our end product. Wanting to take it to the next level, we are going to be having a live cadaver addition to our kind of shoulder and our knee mastermind coming up, and that's going to be a 3-day mastermind. The first day is going to be all business. How do you market? How do you sell? How do you sell yourself?
How do you do, social media? How do you do testimonies? All those kind of bread and butter things you can do to increase the patient volume that you're looking for. And then the second day is going to be focusing more on the shoulder, the hip, those regenerative skills to not just get in the joint, but get the labrum, the meniscus, the subtle little ligaments, and all those things that stabilize both the knee, the hip, and the shoulder, and looking at patellofemoral syndrome and how do you treat that effectively. So there's a lot of stuff we can do there. And then the last day is going to be the bone marrow harvest course with cadaver. We'll have cadavers for all the other stuff as well. And then also other courses on how to do some of the aesthetic stuff. So a lot of people out there wanting to add other revenue streams in their business. So that's all we're all about, is having to teach you guys how to survive and to thrive in these crazy environments. So we'll have some aesthetic stuff going on as well that last day on the P, the O, face, hair, in different ways to augment your services that you offer as well. So it's gonna be an exciting time. So love to see you guys there in person or virtual coming up here in February. And we can maybe go outside and do some skiing and sledding in Minnesota. So it should be pretty fun.